You are watching the DocTalk show.
Welcome back. We are understanding more about heart disease. Just before we went for the break, we understood there are some factors that promote the likelihood to develop heart disease. Smoking, drinking alcohol, some infections can predispose someone to get heart disease. So now I want to understand how we can prevent ourselves from acquiring this heart disease and what has been the role of the government, of the ministry in preventing people or to prevent people from curbing this disease and to fight the disease within the country. So, Dr. Emmy, in preventing heart disease, what main messages can we tell the people there? Because it seems to be a very big problem, and you mentioned the treatments are very expensive, so that makes prevention far better than curing heart disease. So how can someone prevent themselves from getting the heart disease?
So birth defects, in the heart are better prevented by having, expectant mothers who are pregnant to go for antenatal care. They're examined usually during the course of the pregnancy. Some of the birth defects are triggered by infections in the mother or certain undesirable lifestyles in the mother, like if a mother is smoking, drinking, those will cause certain birth defects, or if a mother is taking certain medication. So it's very important for a pregnant mother to go for antenatal care and make sure that they're followed up. Sometimes the birth defects are actually detected earlier than after delivery, which is important. Then certain decisions can be made. Then rheumatic heart disease, as I've said, follows infection with this bacteria that causes sore throat. So part of it, involves making sure that we have adequate spacing, but at the individual level, if you're a parent of a child who comes with sore throat, don't ignore them. Take them to a hospital. The health worker will assess and see if this is a viral infection that is causing sore throat. They'll, probably give paracetamol and other medication that suppress this. If the health worker thinks that this is sore throat caused by this strep A bacteria, then certain interventions will be done, including giving an antibiotic. It's very important because when it's not treated, it will keep happening and it will result in heart disease. So that's important. At the Heart Institute, we have programs around the country where we work with schools and the Ministry of Health and the district authorities to screen for early rheumatic heart disease. Then high blood pressure, it's a multi-sectoral issue. We're doing this with Uganda NCD Alliance, we're doing this at the Ministry of Health, at the Heart Institute, at Malago Hospital, and health facilities around the country. The idea is that at individual level, you need to, number one, avoid adding salt. But certain other things like taking medications, the medications that are given for pain, some of those medications do affect your kidney and actually cause high blood pressure. And then women who are taking oral contraceptive pills, those also can predispose you to having high blood pressure. So if you're taking pills for birth control reasons, you need to work with your doctor to make sure that they're monitoring your blood pressure as well. Okay. Yes, and
so Dr. Mambu, you came out strongly on the issue of alcohol and smoking. What message can you give the public regards those two risk factors?
Yes, I already said that we must, as much as possible, desist from the use of tobacco products in whatever forms. I know there's one form which is not yet here, but which is slowly creeping in. That is the electronic cigarette, because the electronic cigarette is odorless, and you may never know that somebody is smoking. But it all comes to the same thing, that it's tobacco. It has a solution from tobacco, and inside that pen-like gadget is a heater. So you simply switch it on, and you can go and smoke and close it and put it on your shirt just like a pen, and nobody will know that you are accessing tobacco products. So shisha, electronic cigarettes, these are new innovations in the use of tobacco, and they are also equally as dangerous as the person who is smoking cigarettes, and we say do not use any tobacco products. Okay. Alcohol, when you go to a party and you take 1 or 2 beers, that may not be bad when you take it occasionally. When you take it very frequently, it may be a problem. And when you take it in excessive amounts, it certainly is a problem. So if you suspect heart disease, you should go to a health professional get examined, and if you have heart disease, abide to the rules and advice that will be given to you for the treatment of that heart disease. In many cases, you may be started on medication, and that medication alone may be sufficient to control your heart disease. But what we see in the field is many patients who come with high blood pressure. Once started on medication and the blood pressure is controlled, they cease to continue on medication. They believe their high blood pressure has been cured, and so they stop. And that is very wrong. High blood pressure is a kind of systemic illness. It is an illness that has got multiple factors that cause it, including stress. And so when you control it and your pressure comes to normal, it doesn't mean you're cured. No. It only means that the drugs have been effective in helping to protect you from further effects of high blood pressure.
And that means they should continue taking
So
the
you should
medicines.
continue taking your medications. You should regularly visit your physician in the hospital and take the advice of what the doctor tells you to do.
Okay.
Now, medicine sometimes, and I mean just drugs, may not be sufficient. As Dr. Kello told you, that when we get rheumatic heart disease, it can damage your heart valves, it can cause structural damage to the heart, and in that case, medicines cannot pull you out of heart failure. Heart failure per se is a disability. It disables you. You can't do much when your heart is failing because your source of energy is from the pumping of blood around the body. So once your heart has failed, you need to do something to get out of heart failure. If medicines can't get you out of heart failure, then we go to the next level. It may be a structural problem, and in that case, you need surgery. And this is very expensive intervention, and that's why we are appealing to the public that where possible, change your lifestyle and prevent the occurrence of heart disease within you.
Okay. So you've heard very strong messages from the experts in the field of medicine. Heart disease is a very expensive illness to manage. As always, prevention is far better than cure. So you have to watch out for those risk factors, avoid smoking, drink very small amounts. If you can, avoid drinking altogether. You have to manage your weight, control the diabetes, and make sure you go for routine checkups. So it's important for people to have routine checkups, to go for checks with check how their blood levels are, how their cholesterol levels are, the diabetes. All these are interventions put in place to prevent the heart disease from progressing further. So if you can catch it early, it can be managed and it's easier to control. So as we conclude in this discussion, we just want to understand what exactly, how the government has come to in the fight against heart disease in Uganda. We know they have established the Uganda Heart Institute, which is a center of excellence in managing heart conditions. How about the people in the villages, the people who are far away from the Heart Institute? How would they benefit from these heart problems? Dr. Kelly, you'd like to?
A big part of that intervention has been in creating awareness about the causes of heart disease and the burden of heart disease and the different causes and what you should do to prevent heart disease. And the idea is that if you can prevent some of the lifestyle diseases which are expensive to treat, prevent high blood pressure by avoiding excess use of salt, use alcohol in moderation, avoid smoking, exercise, watch what you eat. That's the kind of the message that we're giving. And we are telling pregnant mothers that go for antenatal care. So the key, and one of the things we're telling people is go and have your blood pressure taken. If you're over 40, go and have your blood pressure taken. Could be at a supermarket, could be at a clinic near you, could be at a health center. It doesn't hurt, doesn't cost anything to sit down to have your blood pressure taken. Once the blood pressure is known, then the options are many, and there are many things we can do.
You are watching the DocTalk Show.